Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me today is an amazing guest that I'm very happy to work with quite a bit, Dr. Don Gallo, who's the Chief Clinical Officer for Dental Care Alliance. Very happy to have you on the podcast today, sir. Thanks for being here.
My pleasure, Brian. My pleasure. Happy to impart some knowledge and hopefully some valuable information for your listeners.
Yeah, and I think today we have a very important podcast about PPE, infection control, and kind of how people can navigate this crisis. And how we got to do this podcast was I've just been impressed with the research you're doing, with how you're responding to within DCA, giving the knowledge that you're passing down along to the affiliated offices, the partner offices on how we can stay safe now during this time. And then once right now, but probably by the time that the podcast airs, people will be just starting to ramp back up. And so could you kind of talk a little bit about the knowledge that you've received over the last few weeks as you've been doing your research?
Yeah, sure, Brian. So obviously, it's going to be completely different, right? What we were post or pre-COVID and what we're going to be post-COVID is going to look remarkably different with PPE. What we're seeing, and in a lot of the literature, and we're seeing there are some recommendations by the CDC and ADA. We're going to need to be looking at probably either N95 masks when they come available, or at least a KN95 mask as we relaunch. And we're going to need those for not only our doctors, but also I think our dental assistants and the hygienists as well. I also see face shields becoming an integral part of day-to-day life in the dental office. And we're looking and sourcing a number of different face shields. Again, as you can imagine, with what's going on with the hospital end of it, these PPEs are hard to find and not readily available immediately on the markets.
Yeah, so you feel like going forward for, I don't know if indefinitely or for whatever length of time that this crisis is going on, that so I'm stating to just clarify, a face shield and an N95 or similar mask that pretty much everybody who's being clinically will become what's necessary to see patients?
Yeah, look, I would equate it almost to around the time with the HIV epidemic when it first hit, right? Prior to that, very, very few practitioners were wearing gloves on a day-to-day basis. And then overnight, gloves became a standard of care. Mm-hmm. And again, I see the N95 mask definitely probably going to be the standard of care. And I think face shields. And I think those two will stay. Now, the ancillary stuff, right, that I think coming out of the gate, disposable gowns, I think head covers, shoe covers, I see that as something probably over time that will relax a little bit. But I also see that as a possibility, although we haven't seen any direct mandates on that equipment. And that's even at a much shorter supply right now than the face masks and shields.
Yeah, I think that part of the resistance to mandate right now is because we don't have availability. And then as the availability gets ramped up, I personally think that the mandates will become stricter, right? Because it's hard to mandate something that's not available, right?
Yeah.
Do you agree?
No, it's a great point. And I think, right, so I think each of the state dental associations, right, it's kind of a balancing act right now. We're definitely needed out in the field. We've got to be doing our part to relieve emergency care, patients showing up at the hospitals at this point in time with dental problems that could be handled in the office. And again, we're going to relaunch, and when we relaunch, we're going to be hopefully on the downslope, but there's still going to be a lot of pressure and a lot of activity in our ER rooms. And so I agree 100%. I think that's the balance with what they're mandating as far as PPE, based on availability and also being able to keep providing it to the frontline workers in the hospitals who are definitely dealing with COVID positive patients every day.
Yeah, and to that point, if you do have some of the like the N95 masks and face shields, you've done a lot of research on the N95 and face shields and which ones you can use that are reusable and then how to reuse them. Could you illuminate the audience on that? Because the first point I think is that I've seen some people online that are talking like that they're going to open their practice up like it was 2 months ago. I think that's not going to be a possibility. And so giving people the information so that they can open up when is going to be keyed of what PPE to use and then how to reuse it if the supply isn't available.
Yeah, look, I agree with you. I think one of the determining factors of how fast most practitioners are going to be able to open is going to be the availability to get the appropriate PPE to provide safety not only to their patients, but also safety to their team members that'll be coming back into the offices. And one of the things we've done a lot of research on and looking at is how do we extend these PPEs, especially I would say for the first 60 to 90 days, right? I don't have a crystal ball, but I'm looking for PPEs to start to become more easily obtainable. I would say probably, end of June, end of July, maybe through all of the summer. So we've been looking at ways to extend the life of these PPEs. And for the face masks, especially the N95s once they're available, and for now the KN95s, there's been a couple of really good articles put out. One was done by Midmark, and basically addressed using steam sterilization on the Midmark and Ritter's M9 and M11 units, putting them through a cycle at 250 degrees Fahrenheit or 121 Celsius for 15 minutes. They've had decent results with that. Out of Stanford, the Stanford researchers affiliated with the hospital have done some studies on convection ovens, right? Dry heat. Being able to put these in a convection oven at 167 degrees Fahrenheit or 75 degrees Celsius on a 30-minute cycle. And then the last one that's gotten a lot of press, and it's one of the ones that we went after early on, was the use of UV light boxes, right? So using UVGI or ultraviolet germicidal irradiation, and looking at biosafety cabinets. And, you're looking at 254 nanometers of UVC light. And those also, you can go on now and research those, and there are availability, some of those on Google. But we're also looking at the opportunity to extend them out with that.
And we've been using that in our office, and I've been saying that in a lot of cases through this COVID crisis that we really are picking the best of some bad options, right? And so doing whatever we can to get as the PPE as protective as we can and reusing them. I think I agree with you. It's a big problem right now, and it's not just it's almost a moral dilemma too, because you have to protect yourself, but also you don't want to have excess and take it away from the hospitals that need it too. So there's a lot of factors that go into this. So I appreciate you doing a lot of research on it.
Yeah, look, preservation is going to be key, and for us that grew up in the 70s, it's a great time to break out those blacklight posters, right?
That's what you remember from the 70s, the blacklight posters.
So, but no, I think we all have to do our part, and I think what's critical for us, right, is relieving the burden at the emergency rooms, but also being very strategic and very smart with our PPEs. And again, with the face shields, right, we're looking at, multiple uses for face shields. We're looking at a dilute isopropyl alcohol spray. We're also looking at maybe putting some peroxide in there. There's been a lot of literature written that this COVID virus seems to be very susceptible and to lysis with a diluted hydrogen peroxide solution. Mm-hmm. So again, I think relieving the burdens of the ERs and then being smart and strategic with our PPEs is going to be critical as we relaunch.
Yeah, and I read it somewhere that 78% of dental offices are open to see emergency patients, so 22% aren't. But for those of the audiences that are, if you're still closed down except for emergencies at the time of this podcast going live, make sure to communicate to your patients and to your communities that you're open. One of the great things that I see a lot of Dental Care Alliance's offices posting as hashtag dental ER to get the word out that to patients that they should stay out of the emergency rooms and come into the dental practice for their care. It's a very important message too.
Yeah, and look, I would also say for your listeners, if you're in a secondary or tertiary market, you may find that your ER rooms and your urgent cares are going to be more than happy that you reached out and let them know that you can ease some of the burden that they're seeing inside their hospitals.
That's a fantastic point. Well, thank you very much for being on the podcast and for illuminating our audience like a blacklight poster to the what PPE they should be looking at for now when they're seeing emergencies, and then also as they start ramping back up. Thanks a lot.
No, it's my pleasure. Thanks for having me on, Brian. I really appreciate it.
Sure thing.